Hello, everyone. This is Dr. Deborah Durst with Revitalyze MD. And a little bit about me is I'm a traditionally trained MD with a specialty in emergency medicine, and I worked for 25 years as an emergency physician. And I began my journey into anti-aging about 10 years ago and focused in on aesthetics, wellness, and sexual wellness. And since then, I have been passionate about helping people look, feel, and function better. And today I have a guest with me, Samantha.
Hi, everyone. My name is Samantha Addis. I am the office manager at Revitalyze MD, and I work extremely closely with Dr. Durst and her patients. And my main goal is to make sure that everybody's patient experience at the office is top-notch.
What do you think we should talk about today? Is there something that patients are asking about frequently when they call that you think needs to be better clarified?
I think that one of the top questions that we get on a daily basis, just recently even, is what are PDO threads? Are we doing PDO threads? So if you want to give a little bit about what PDO threads are exactly, they've gotten extremely popular in the past 6 months. So just go a little bit into that.
Sounds perfect. I think that's a great topic because we have gotten a lot of calls. And again, I've been doing PDO threads for years, but it seems that over the last maybe year, 9 months or 12 months, that they have become extremely popular.
Oh, every day we're getting questions about that.
Yeah. So PDO threads are absorbable threads that you can use for lots of different reasons. But one of the main reasons that people seek them out is for lifting. And so it is an in-office procedure that's very comfortable, but also stimulates collagen and elastin in the track of the thread once placed. And so it does a great lift. Of course, there's other types of threads besides just the lifting threads where we can actually stimulate collagen and elastin and not do the lift as part of it. But a lot of reasons why people want them is because it will lift certain facial features that are bothersome to them. So that is a almost daily procedure now.
Yeah, it is. Do both give you immediate results, like both types of threads, or what are the differences there?
So the different types of threads are, there is lifting, which, can be termed different things. It can be a molded, it can be a barb, and those will give you immediate results with lifting. There is also a twist thread, which will give you immediate results but doesn't lift. So it might fill out a nasolabial fold or maybe a lip border. And then there's smooth threads we can use that don't give you immediate results at all, but do build collagen and elastin over time. So one of the areas that we use it is in the submental area, because that will help form collagen elastin and firm that area up, because we all kind of get that turkey neck, double chin, and so it helps subside fat and build collagen elastin. So that would be a good
preventative treatment?
Great preventative treatment. And the nice thing about PDO threads is it does help build collagen elastin over time. So even though the thread may break down over 6 to 12 months, you actually have already started to build collagen elastin. And so that lift continues to get better over 3, 6, 9, 12 months. So there are other procedures that also, can give a lift in a non-surgical way.
Which are that we do at the office?
Yeah, we have lots of different options. And so even if a patient calls about PDO threads, I definitely think getting in for an aesthetic consultation is a great first step, because we can talk about PDO threads and then other options. And, just so people know what those other options are for non-surgical facelifts, is all therapy is one of them. And all therapy we don't get as many calls about, do we?
No, not compared to PDO threads.
No. And so, but it uses ultrasound to get to a deeper level called the SMAS layer, which is the muscular layer that the plastic surgeons actually target for doing a facelift. So basically, you're using ultrasound to get to a depth to cause a lift in that muscular layer. The issue with all therapy is to get to that depth, it's often painful.
Yeah, that's right.
And so that's one of the cons of the all therapy. And then another one probably is you don't get any immediate effect. And so PDO threads, aren't painful, quite comfortable. Sometimes if they watch the video, it may not look that way.
Yes,
but
it's definitely scarier than it looks. Or than it actually is. It looks scarier than it actually is.
Correct. And so I think, again, sometimes people will watch videos, some don't when they come in. Either way, I just like people to know that it isn't painful. It's quite comfortable. Mm-hmm. You do get immediate results. And those are the differences between PDO threads. And PDO threads are regenerative. So it's building that collagen elastin, and all therapies lifting at the muscular layer, but you're not really getting as much regenerative formation of collagen elastin as you do with the PDO threads. And some other options?
Morpheus would be a good one because it is also good for collagen building.
Yeah. So Morpheus is another non-surgical facelift option. And if people aren't familiar with Morpheus specifically, what it is radiofrequency microneedling. So
I always say that's microneedling on steroids whenever people ask, because they're familiar with skin pin. So if you just say it's microneedling on steroids, they sort of.
I think that's a great description for it, because it is. So what happens is microneedling is without energy, and radiofrequency microneedling is you're using energy and driving energy into those micro channels that you're forming with needles, which are either with a microneedling or with the radiofrequency microneedling device. So you're actually combining two treatments, a radiofrequency treatment and microneedling. So you're driving energy deep and forming collagen elastin. It goes much deeper and it's much more stimulatory of collagen elastin. So,
and it's still painless though, because we do numb you. You're fully numbed before you go. So people always ask that too. Well, is it more painful? I'm like, no, because we always are doing numbing.
And then we have that other option too of Pronox, which is so. Again, all therapy, you can't really make more comfortable with topical numbing because
it's going so deep.
And so to get that deep penetration, that it's painful to get to that level, and topical numbing doesn't work. But Pronox can work, and we'll talk about that in a moment. But with Morpheus, then you can use topical. And if somebody arrives to the office, a little bit early for their appointment, we'll put a topical and a mask on, sometimes put them under the light stem for better penetration. And so Morpheus is quite comfortable, minimally invasive, just because you're doing microneedling at a deeper level than you are just straight up non-energetic microneedling, but very comfortable.
Yeah, I would say. And then another option that we have is the Fotona 4D facelift, which is very popular as well.
Fotona is actually my favorite procedure. And the main reason for that is it's 4 laser treatments with 1 session. So basically, not only are we making the skin healthier on every level, from the deep dermis to the epidermis, but you also get a resurfacing. So when you're making your skin healthier and you're building collagen elastin in all those levels, including an intraoral component to that, we're hitting the nasolabial folds at a deeper level. We're helping lift and eliminate those. And then also lines around the mouth and the perioral, because we're lasering inside the mouth. And then we go for 2 steps where we're doing that on the outside, and then we hit it with a resurfacing. So you get tightening, you get firming, your skin is thicker with each session. And then you get a resurfacing, which helps with pores and fine lines and wrinkles and kind of just sanding down that outer layer. Yeah. And so again, very comfortable procedure and no downtime. You can do it all year around. And again, you get that immediate result. It's regenerative. It's not painful. And I think a lot of people want immediate results. So I think that's the downside to all therapy. Is it's painful and you're not going to get anything immediately. Yeah. And so one other option for like younger patients like your age potentially is Forma. It's going to do a lift and build collagen elastin. It's using radiofrequency as well, but it's really just applying heat. And so very comfortable.
Feels like a hot stone massage. So it's definitely very
comfortable.
Soothing,
Definitely a maintenance, preventative. It also or almost should be done on a monthly basis for younger patients. It's not something I would recommend for an older patient that's really seeking more of a lift. That they can do for more of a preventative, but not so much as a treatment. But for a younger patient, you guys get the concept of stimulating collagen and elastin early and preventing instead of getting to the point where you need treatment. Any other questions about that?
I guess one question is, when do you think patients should start doing these treatments? Like, when is it too late to start?
Well, I think that's a great question because I don't think it's ever too early to start. And again, I think the younger you are, Forma is a better option for that, for more preventative, so that you never get to the point where you really are in need of a more severe lift. And then I think that likewise, all of them should be done as a prevention because we lose collagen, 1% of collagen a year. So if somebody starts getting aesthetic treatments at the age of 40, we're already about 40% down. And so for that reason, I don't think it's ever too late, but I would go with more of a regenerative method, such as Morpheus, where you're stimulating more collagen and elastin and lifting, and you do get some resurfacing with that, or a 4D where you're regenerating and making that skin healthier overall. And I like to combine different modalities. So if somebody needs better skin texture and thickening of their skin overall for a more healthy appearance of the skin, then, pairing that with a regenerative 4D might mean that you need less in the way of threads when we do them. And then, but I don't think it's ever too late to start. We just need to set realistic expectations because it's not a surgical option. So if somebody has quite a bit of sagging or volume loss, then when we're lifting with threads, they might have unrealistic expectations where it's not a surgical option, but you'll get improvement. But I think, again, when they're more severe in their needs, then I think we need to pair it with a 4D, which again is one of my favorite options, and then use the threads after the 4D. And then sometimes we need less in the way of threads. As far as pain, again, I think that Pronox is key. So if anybody is uncomfortable with a procedure, and Morpheus is really the only thing that comes to mind, and it's very comfortable, but occasionally you have a patient that just doesn't tolerate it as well. And so what Pronox is, as you know, because we use it, is laughing gas. So we've actually frequently had people come in just wanting a laughing gas, right? Without a procedure. So, but it has to be self-administered in our office. So it's something that they hold and breathe in, and it really helps eliminate the anxiety and kind of dissociate you from what's going on, but you're still awake, you can still talk. And so we have that option available at the office as well to help with anything.
So what things might people start noticing that would lead them to needing these lifting treatments that we offer?
So I think a common area or complaint is the nasolabial fold in jowling. So the nasolabial fold is in between the cheek and the nose, where your cheek starts to look heavier. And so frequently they think they need filler in there to fill that out because it starts to almost look like a valley there. Your cheek's heavy. There's a valley underneath it leading to the nose. And so really frequently what they need is lifting in some way. And sometimes it's volume. But again, these procedures are great at taking the tension off that tissue and lifting it either with a thread. And again, 4D is an awesome way to do that because we can also laser inside the mouth with that first step and really fill out the nasolabial fold. And, again, all therapy is usually a one therapy, and 4D or Morpheus are usually, 3 to 4 sessions. And so each session with the 4D, we're going to hit that nasolabial fold and be filling out that volume. And so you're going to get improvement, and then you're going to get cumulative results each session. And then I think jowling is another area. So jowling is, also known as the marionette line, but it's kind of in the jaw area underneath the mouth where it starts to, again, look heavy and form a shadow and a line. And that's another area of complaint. And so these lifting procedures help take the tension off that. And even if we ever did need to get to a point where we needed to do some filler in some way, it's really doing it in a way that lifts that area from another area and not actually putting filler in the soft tissue in that area to fill it out. And so again, I think the 4D is awesome at filling those areas out, and then the threads help take tension off, so those work well in conjunction with each other.
And then is there any skincare products that you would also recommend doing with these lifting procedures? Or we have collagen in the office. Should they start taking that daily?
It's a great question. Love that question, actually. So, I mean, I think everyone should be on collagen powder and, whole body collagen.
I guess to backtrack a little bit, what, for people who are listening or watching, what exactly is collagen?
Collagen is what we're kind of forming. So it's a structural component of skin. And so is elastin. So elastin kind of allows that elasticity in the skin. So it makes it, when you're stimulating collagen and elastin, you get that total vitality in the skin. And all of those are structural components. So when we're doing these procedures, again, 4D threads, where they're more regenerative and building collagen and elastin in forma as well. You want to also take in collagen, which helps you build that collagen in the skin. So I think everyone should be on whole body collagen. And if you're taking it on a daily basis, is best. And again, when we start to do these procedures with a full aesthetic, consultation, of course, skincare is important, but those supplements that are going to help you build those structural components are very important. So I'm so glad you asked that question.
Yeah, I've heard of patients even noticing the effects from collagen, like after 2 weeks of doing it. There was one patient that she said that she started taking it daily or powder, putting it in her waters, and she noticed like more glow, that her skin looked less saggy. So I do think that it's very important.
Yeah, it works very well. And then likewise, if you're doing that, hydrating, is an important thing. And if ever you feel dehydrated, we also do IV therapy, and those are things that you can have done during procedures, so that you're getting hydration at the same time as getting a procedure. So you're not just isolating those out. You can have two things at once while you're doing it. But I think supplements are important. And again, you asked about skincare, and I think that with skincare products, you always have to be on them. There's no sense in doing regenerative or lifting or any services really without good skincare products. So something that's helping you cleanse, get, your pores cleaned out, exfoliating, oil control. But then again, with these procedures, adding something that might hydrate, like an HA intensifier, is good. With plumping, you can have triple lipid repair, daily power defense, growth factor with ZO. So there's lots of different products. And then likewise, we have, our RMD cream, which works really well because that's a, office formulated product that is a prescription only, but also does have a peptide in it, which is very good at structural support. So, but I think that if you're getting any of these procedures, when we're doing a more comprehensive aesthetic evaluation, addressing all those, such as skincare products. And again, collagen was a great question because that comes up with everyone that's getting these procedures done. So,
well, I think that was pretty good. I think we went over all the options that we have. So I think that these discussions have just been great because we're getting our patients' answers to the most frequently asked questions, and it's all coming from Dr. Durst. So they're getting trustworthy, reliable answers, and it's really making them comfortable with coming into the office. And we're also promoting all of these things on our social media, like our Facebook, Instagram, YouTube. So we're reaching tons of different people through those platforms. And if you also are interested in getting scheduled for a consultation, you can call the office, text us. We respond via email. We are extremely reachable.
And I think likewise, if you like and subscribe and definitely share with friends. And if you have any other questions, definitely leave them in the comments, send them to us so that we can address them, because we're here to dive deep into all subjects, wellness, aesthetics, and sexual wellness. We're not afraid to talk about anything. So anything you want to discuss, let us know. And we're here to revitalize your look, your health, and your sex life. Thank you.
Bye.